Dr. Toyin.
Yes, ma'am. Good afternoon, ma'am.
Yes, I want.
Yes.
Yes.
Good afternoon, everyone. Good afternoon, principal, the vice principal, and all the teachers present today. It's nice being a part of this career day talk. My name is Dr. Toyin IYARE, and my topic for today is the perspectives and aims of a medical practitioner. So I'll start with the introduction. A medical practitioner is also known as a physician or a medical doctor. And this is a person that is regarded as a health professional who practices medicine concerned with maintaining or restoring our health through the studying, diagnosing, prognosis, and treatment. Okay. So, as a doctor, you may focus on certain disease categories. And this is what we require, this is what we refer to, as specialties. Or may decide not to specialize and assume responsibility for provision of comprehensive medical care to individuals and families. And this is what is referred to as general medical practice. Let me explain it to you. For you to be a doctor, you can decide to just be a general medical practitioner attending to every diseases and all that, or you may decide to specialize in a particular aspect of medicine. So that's what that line is just talking about. As a doctor, you can work in any levels of the hospital, from the primary health care, where you work maybe in a local government or in a community, or a tertiary hospital. Now, there are three cadres of a hospital. The primary health care, where you see in the community level, you go there for your malaria, typhoid, and every other thing. Then you have the general hospitals, which are the secondary hospitals. When you have things that the primary health care cannot handle, it is referred to the general hospital. Then when you now need specialist care, you have to refer the patients to a tertiary hospital. Next slide, please. So for you to gain admission into medicine, if you want to study medicine, there are things that are required of you, subjects you need to offer in secondary school. So for your SSC or NECO, what is required for you to be able to get admission to study medicine is mathematics, English, biology, chemistry, physics, and any other 4 subjects to make up your 9 subjects for your WAEC exams. Now for JAM, you also have to do JAM exam. What you require for medicine is just chemistry, biology, physics, and English. The admission scores vary across different universities. It's usually an average of the scores in SSC or NECO, depending on whichever one you are using, and your JAM score as well. And in some cases, some universities use your post-JAM as well. So what I'll say is that the higher your grades, the better the chances of getting admitted for medicine. What this means is that you must ensure that you get A's if you want to get a higher chances and score very high in your JAM. Next slide, please. So to study medicine, you have to know the duration of the course. And for medicine, you have 6 years. That's the normal duration of studying medicine. So your first year, which is the 100 level, is what we call the pre-med year. And when you are in this level, on this level, what you do are just your basic sciences, just similar to what you did in secondary school. But at this time, they are at advanced levels. So what you just do is physics, chemistry, biology, which is broken down to zoology, study of animals, and botany, study of plants. Then you also do mathematics. At this level, you are expected to pass all these subjects or courses, because if you don't, you won't be able to cross to the medical school or promoted to the medical school. So there's nothing like having a carryover on this level. After you've passed this level, you are promoted. That's you move to the medical school. And in the medical school is where you spend your remaining 5 years. So when you are in medical school, you are expected to do 3 professional exams. And these are the exams that qualify you to be a practicing doctor. So the medical school proper. Every medical school is always attached to a teaching hospital. What it means is that when you are in medical school and you are taking your lectures, you also have to be going to the hospital to acquire clinical or practical skills. So students are required to attend clinical meetings. Clinical meetings are organized by qualified doctors where they teach you how to make diagnosis and treatment of patients. They teach you how to examine and every other skills you need to acquire. This is also done by hospital rotation in different units like pediatrics, surgery, internal medicine, and obstetrics and gynecology. So what it means is that for you to acquire a complete skill, you have to pass through all these departments for you to say that, yes, you are now a qualified doctor. So some of the courses you have to do when you are studying medicine. One of them is anatomy. And this teaches about the physical structure of the human body, where they teach you all the muscles, the names of the bones, the number of the bones, and their functions. So you also do physiology, and this talks about the normal functions of the body. You also have pathology. This teaches the abnormalities and disease. So you have to know the normal functions and also know the abnormal functions. So you have pharmacology too. It teaches you about drugs, the uses, and side effects when administered. So you have to know when you administer your paracetamol, what are the kind of things you are expecting, and what are the side effects the person can experience, so that you can be able to manage all. Also, it also helps you when you are prescribing drugs to know whether this person will react to this drug or not. Then you have hematology, that talks about the blood and blood diseases. Then you have pediatrics, where they study everything that concerns children. Surgery, in case you need to do an operation for anyone that requires this. Medicine, this is more of making diagnosis and treating without having to go in or being invasive to remove the cause of the problem. Then you have the obstetrics and the gynecologists that handle the pregnant women and females for their reproductive health issues. So this is just to mention a few of the courses they offer in medical school. So as a student, you need to be very focused, disciplined, and also need to constantly be in touch with your books. There's nothing like everybody's going out for a party and I have to join them. No, you need to read so that you can excel in this course. Next slide, please. So as a newly qualified medical practitioner, the first thing you do is they issue you a provisional license. This means that you are not a doctor, but you are not fully qualified to practice on your own. So for you to be able to practice on your own, you have to do a 1 year of compulsory internship in an approved hospital under the supervision of a qualified doctor. When you complete this, then you get your full registration for you to be able to have your own main practice and practice without anyone supervising you. After this, you go for your 1 year compulsory National Youth Service. You'll be posted to anywhere. You might be in a community. So from the skills you acquire during your internship, you'll be able to handle most of the cases you come across during your youth service. After this, you may decide to just continue as a general medical practitioner, or you go into specialization. So for specialization, it's mainly divided into two, medicine and surgery, and they both have several subdivisions. The difference, or what differentiates them, is that for medicine, you treat mainly with drugs. But for surgery, outside drugs, you can go in and decide to remove whatever it is that is causing the problem. So for you to be able to specialize, you have to do what we call residency program. It's a training program for qualified doctors. So for residency program, you use a minimum of 4 years and a maximum of 9 years, depending on your area of specialization. 9 years, example is neurosurgery. They spend as much as 9 years to be able to get qualified to specialize as one. So during residency, you have 3 levels of exam as well. There's the entry point, where they call primaries. Then after like 2 to 3 years, you do what we call a part 1 exam that makes you an associate member. And after your 4th year, or depending on the specialization, you do the last one, which is the part 2 exam. Next slide, please. So as a medical doctor or a medical practitioner, you can work in any of the following areas: the regular hospitals. You can work in the academic setting as a lecturer, where you tutor medical students. You can also work in a research institute and make discoveries. You can work in the ministries as well. Next slide. So I know we've heard of different specialties, but some of us may not be used to so many of them. So I've just listed an examples of a few specialties for us to understand when we need things to, that's when we need to see a particular doctor that treats special illnesses. So I'll start with a pediatrician. They treat children from birth to young adults. That's 16 years. Anything above 16 years, you have to receive your regular medical practitioner. So we have the geriatricians. These ones are just for the elderly people. Then you have the dermatologists. If you have any skin-related disorder or problem that maybe your general practitioner couldn't handle, he will definitely refer you to a dermatologist, who will now take a good look at it, make a proper diagnosis, and treat appropriately. We have the ophthalmologists. These ones take care of the eye and vision care. They also perform surgery. So when you start complaining of eye pains, I can't see well, I need glasses, so you visit the ophthalmologist. Then we have the obstetrics and the gynecologists. They deal with the female reproductive health and diseases. For example, a woman that has infertility and looking for a child can visit a gynecologist. For pregnancy and delivery, that's an obstetrics, and obstetric doctors handle that. We also have the cardiologists. They deal with heart and blood vessels. They manage high pressure, high blood pressure, heart failure, stroke, and cholesterol. Then we also have the endocrinologists. These ones are the ones that have no conditions that affect the endocrine system. For example, you have diabetes. Then you have the dentist, which I know most of you are familiar with. After eating all the sweets and chewing gum, you need to see your dentist who manages the teeth and everything related to your gums. Then we have the nephrologists. They manage kidney problems, but these ones do not perform surgery. So what they just do is they give drugs to see how much they can salvage the situation. Then we have the urologists. They also deal with kidney-related problems, but they do corrective surgeries as well. Then there's something we call the ear, nose, and throat surgeons. So when you have issues with your ear, your nose, or your throat, you visit an ENT surgeon. We have the psychiatrists. They treat mainly the mental health condition of people. There's the oncologist who treats cancer. We have the radiologists. They use what we call radiation to diagnose health condition. Examples are when you do your chest x-ray, abdominal ultrasound, or a CT scan. All these are used for diagnosis. Then we have the radiation oncologist, who also uses radiation to treat every cancer condition. We have the general surgeons. They perform surgical procedures on organs and body systems. So when you say, I have an inflamed appendix, you visit a general surgeon who will remove it so that you can get better. We have the orthopedic surgeons. These ones, they treat anything related to the bone. Then you have the cardiothoracic surgeons. When there's need for a heart surgery, these are the people that handle such cases. So as a doctor, you are expected to have a good knowledge of medicine, psychology, good counseling skills, including active listening and a non-judgmental approach. What this means is that when your patients come and they are telling you, see, I have headache, I have this, not that as the patient is talking, you are busy doing something else. You must be able to pay attention to details. You must also have excellent verbal communication skills. Be able to communicate with your patient, and that's the way you are able to get more information and better diagnosis. And you must also have the ability to work long hours. Because if you are not have the passion, you won't be able to practice well. So thank you so much for listening.
Thank you. A round of applause for our doctor. I know she's got a lot of things to say to you guys. I know. But because of the time constraint, please now we want to entertain questions. If you have questions, I'm going to number those that ask questions. If you have a question, just raise your hand. I won't give you numbers. Okay, I have one person here. One. Who else? Just one? Just a person. Baby girl, come forward, please. Okay, are you raising your hand there? A round of applause for her. Please come forward, my baby girl. Thank you. God bless you. Introduce yourself.
My name is Grace Shire. I'm from SS1 White. And my question is that people that treat others.
Hello, please. Boys and girls at the back, please let's pay attention.
People that treat all those sickness, can they study all those courses?
Okay. You mean they should study everything together? Wow, my doctor, I hope you are listening. Did you hear the question? IYARE. Hello? Are you
Hello, I'm here.
Yes, did you hear
I
the
couldn't
question?
hear her well. She should speak up.
Okay. Let us say it again, but the question was very interesting.
My question is that all those people that treat all those sickness, are they going to study all the courses together?
The question
Yes.
is this: can one, as a person, study all these courses at the same time, or do we have to, split, specialize in a particular area? That's the question.
Okay. For the if you're in medical school, all the courses I mentioned earlier, yes, you have to study them together. But for specialization, no,
Okay.
that's a different thing.
Okay. Did you get the answer? So it's possible for you to do all the courses while you are still in school. But the moment you leave the school or you are preparing to specialize, you have to pick a particular field, pick one. Then you have to concentrate on that and be a specialist in that. Any other question from any other person? Okay, let me ask you questions. Or she should ask you questions. Yes, my dear. Come forward. A round of applause for her, please.
My name is Victoria Oyeniro, and my question is, after you finish studying all these courses and you choose the path you want to go to, if any other person bring another thing to you, can you also do it? Like, okay, if you choose to be a medical doctor and another person bring another option for you, like if somebody is sick, can you also go for the person?
My doctor, the question, did you get the question?
I think she said if you study medicine and
Yes.
someone else comes with a patient, can you also treat? I think that's what she said.
Yes, yes.
When you study medicine, like I said, you can be a general practitioner, so you can be able to treat so many treatments. You can, sorry, you can be able to treat, yes, ailments, I meant. Yes, but when you specialize, you are now facing a particular field, and that's where you now, the disease you treat.
Hello, she's acting before the internship.
Okay, before the internship.
1 year internship. Can she treat anybody?
Oh, okay, I get the question now. If you are not a qualified medical doctor, you are not allowed to treat anybody. It is illegal to treat anybody if you are not licensed to do it.
Did you get the answer now? So if you are not yet qualified, as in being given the certificate, if you are caught, I think there's a jail term for that. So you just have to know that, okay, this is what I'm doing. I have to spend the right time, get the right qualification. Then I would be able to work in that field. That's it. Is that, did you get the answers now? Okay. Any other question from any other person? I was expecting the SS3 student to come forward. I believe we have medically inclined students here for SS3. If you are in SS3, let me see your hands up. No SS3 students here. So they're not interested in being a medical doctor. Okay, thank you. You're just in science class. Okay, no problem. They want to be doctor, but you don't have questions. Okay, no problem. That means they're already. Okay, if you want to be a doctor, let me see your hands up here. I want to be a medical doctor. 1, 2, 3. And you don't have any questions. Okay, you're telling me you're not impressed with all she has said. You are impressed. Okay. Okay, let me ask this question. While she was teaching, she said so many things. Yes, I want someone to boldly come out and mention 5 of the areas she mentioned of specialization. Oh yeah, come. If you were truly listening. Come, my baby girl, come. Come here. You jotted some things down. Come, you can come and read it to us. Tell us those areas that you jotted. Thank you. A round of applause for her.
Good afternoon. She mentioned Salvador Nyola. She mentioned the courses you have to study in university, and she mentioned the subjects you have to do in WAEC, and she mentioned some medical careers you can go for. dentist, oncologist, gynecologist, end surgeon, onologist.
I appreciate the fact that while our speaker was talking, she was jotting. Most of you were just there playing. Please, I don't want you to see this as one of those talk things. They're just here to make fun. Let's just sit and just enjoy ourselves. No, we are thinking in our hearts that it's not by just coming to school and just sitting down. You need people to be motivated. That's why we are here. Please, let's take everything serious. The teachers are also here to guide you. Don't just take it as one of those things. So please, we want to appreciate our teacher, our speaker for today. In the person of Doctor, let's appreciate her. Let's stand up and say a big thank you to her. She left her time. She's taking out her time to give us this speech. Thank you. We appreciate you, Doctor. And we pray that we'll see you one of these days too.
Yes,
in person.
you're welcome.
Thank you.
You're welcome. Thank you so much.
So we're going for a